Hello, everybody. My name is Dr. Kashif Abdullah. It is May 13th, 2020, and I am answering any questions anyone has regarding COVID-19 questions. Um, I do this like every day. Well, no, during the weekdays from 12:30 to 1 o'clock. And if anyone has any questions, feel free to ask on the comments section. I can just say hello like that. And I try to answer. I'm trying to broaden this also to other things, other topics that may interest other people. If you have any other topics, any medical topics you'd like to ask, you can feel free to ask. Now, I will say that I'm a U.S. trained physician in San Jose, California, and I have my own office. And I also am a medical director for hospice and home health. And I might discuss that too today of what is hospice, what is home health. And but I wanted to start off with the COVID-19 situation. So let's switch here. And then let's go here and switch. And go right there. Let's see if anyone has a question. No. So let's see. Oh, if anyone out there, yeah. So let's see. So if we look, there has now been approximately 4,300,000 some odd cases in the world of COVID-19 that have been recorded. And the U.S. now has over 1.3 million some odd cases. Their number of cases are trending down slowly, but if we use this general trend to figure out how long this is going to take, well, frankly, that looks like it won't be zero until like September, if you're using this trend. And I know the US, because I live here, is beginning to, many states want to relax restrictions already, even though I believe it's too premature and they are doing it too haphazardly and it's dangerous. I think this will lead to people's deaths. If you just open, there's no appropriate testing in the US here, and there is no vaccine that we have yet, and we have remdesivir as an antiretroviral, but that's not good enough right now. I would say I'm critical of the administration's handling. I have been since the start of this, and let's see. The next worst case is actually Russia, and you can see the Russians there is no abatement yet in their rates. They're still increasing. They were at one point, I don't know, fairly down, but recently they have been jumping up, and now at 240,000. At the rate that they're going, it's just, I think eventually the Russians actually will have more cases than the U.S. at the rate that they're going, frankly. I know they're only 200,000. The U.S. is 1.3 million, but I'm fearful what's happening in Russia. The United Kingdom, they are trending down. Their amount is way less than the United States. The United States have, like, look, if you look here, they have like near 20 some odd thousand cases every day, and trending down from near 30,000. The United Kingdom has only 5,000 or like 4,000, 3,000. So Spain is also almost completely controlled it. Italy has been been really, if you look at it, they look at that 802 cases only, and then recent jump up of 1.4 thousand cases. So they have really brought it down. I would say they will have controlled COVID-19 completely, for the most part, by the end of May. By the end of May, beginning of June, the worst hit country will have controlled it very well. They've done an excellent job. They should be proud of their public health department in Italy, and they've done what needs to be done. They've done, they have a very elderly population, and they've done a marvelous job of what needed to be done. Brazil is also increasing, and France is very well controlled. Germany has brought it down also very significantly, just like the Italians now. And but I will want to speak about a German reuptake is happening. like a second wave in Germany may be happening, but I'll talk about that a little bit later. Let's see if there's any questions. No questions really. And in Turkey, you can see that there continues to drop. Iran, they're also dropping. Let's see, China. I don't. It's not pointless to even talk about China. Frankly, they're lying about their numbers. The world knows it. Everybody knows it, but they just want to believe nonsense. India is also going up and up. The Canadians are beginning to drop their number of cases too. They're a smaller country than most of the world. It's only 30 some odd million. I am Canadian, by the way, but they're on their way, hopefully, to control this. I would anticipate that their level of control maybe by June, but by June, July 1st, Canada Day being July 1st, probably by Canada Day, most of Canada will be opened up. Belgium, the Belgians are doing really great. Peru has not been doing that good. They've been going higher. Saudi Arabia is just going up and up and up. No control, really. Let's see. The Netherlands have really brought it down a lot. Mexico is also going up. Chile is also going up. Pakistan is like India going up. Switzerland, Ecuador, I would imagine also is spotty, really. That doesn't give me enough data to tell you what's happening. Switzerland has done a marvelous job of dropping it down now to like 39, 36 cases. Basically, it is completely controlled in there. Portugal also very well. Sweden, the people say, oh, the Swedes are doing, just let it. I don't like Sweden's idea of just letting it do whatever, letting the people. I think contact tracing and control. I think, frankly, Sweden have controlled it much better. They're doing decent, but I think they're doing better actually there. Qatar, Belarus, Singapore, Ireland are bringing it down. But let's see. Let me see if I can also talk to anyone who is live streaming as well. Let's see. Is there any live streamers out there? Let's see. So we live stream. I'm just looking for I don't know if these people are talking.
I can't believe China's blaming the US for this whole virus thing. What?
So that's just an active rate. Let's see. Let's see. Oh, I'm just telling people that I'm out there. So let's mute that. But let's see, is there anyone else? No. Okay, so we'll go back and forth. So we can see that the numbers of COVID-19 are beginning to come down, but there is now a resurgence happening here and there. And Germany, here's a news article I looked up. Germany infection rates rise as lockdown eases, and that's a big concern I actually have for the United States. So it says here that let's see, the number of infections are now rising in the country. And the report says the reproduction number is blah, blah, blah. So basically what they're saying is they're beginning to reduce their lockdown, and more people are getting infected. People are getting protest. Looks like this is happening also in the United States, unfortunately. And I think this is a concern here in the United States that needs to be addressed. Let me just switch on. So I just wanted to say that we can't just keep doing this thing of doing like in the United States especially, we're doing half measures. What we're only um, just like especially in California, there's beginning to have relaxation. They're going to start relaxing um, restrictions, and I think that's too premature. Um, I understand business has to get started as well. People want to make money, and I can say that for myself, yeah, for my own practice, yeah, I've seen a slowdown in people. Like basically, for me, I have a medical practice in San Jose, and what people would basically do is they call in and they say they would like to come in and they like to be treated for high blood pressure, cholesterol, diabetes, what have you. But since I'm now doing stay at home, I'm doing more telemedicine. But I'm also a hospice medical director, so most of the time these days I've been spending talking and dealing with hospice patients and or the hospice companies. And I thought I'd discuss what is a hospice, what's a home health, and that kind of stuff. So, a home health agency is basically a set of nurses or occupational therapists, physical therapists. They're basically like rehab at home. So if someone's in the hospital, starting off in the hospital, they get, let's say they went in for, I don't know, like we'll say for someone generalized weakness. They're very very weak and they start falling a lot, or maybe they had pneumonia, or they had an accident, they broke their hip or something like that, right? What would happen is they would go to the hospital, they get treated immediately there for a couple of days, maybe 3 days, 4 days tops. Then they get transferred over to a rehab facility, or if they're strong enough or they go home, but they still may need help. And if they need like someone to take their blood pressure frequently, or they need some more physical therapy that they already having in the hospital, or occupational therapy, they could do that at home. And nurses or other clinicians would come in and serve that purpose for a couple of weeks for that transition of home, so there's more, so they don't bounce back to the hospital. So that's sort of what home health is. Hospice is basically comfort measures. It's essentially, this is not something that people think of, if you go on hospice, that we're trying to kill you, God forbid. No, you can always go off hospice anytime you want. Hospice's primary function is when someone doesn't want active treatment anymore. They just want to let nature take its course. They will essentially they just want to let nature take its course. So we will provide any kind of services, any kind of pain medicine, any kind of oxygen therapy, beds, any kind of fancy beds. We'll bring in other specialists, and the nurses will come in more frequently, have more active access to other means. And so it's a way of just transition. Now, if you decide while you're in a hospice, after a couple of months, or if someone lasts that long, hospice is only supposed to last 6 months. But if the hospice is only for like if someone's only going to live for a couple of days or 2 weeks, hospice is there for them. And if just say they say, well, I did some treatment for cancer and then I want to restart. Maybe someone went on chemotherapy, radiation therapy, and has bladder cancer, what have you, and says, what, I don't want to stop therapy. I want to go back on therapy. You can always revoke hospice and go back to home health, and you can go to the hospital again. No one says if you're on hospice you have to stay in hospice for life. So it's a way of trying to just give you that last bit of comfort while one is passing away. So I'm a medical director for a whole bunch of these places. And I can show you some of the qualifications for hospice if you're interested. Maybe I should make a question, just a topic on just hospice itself, and talk about hospice and what is home health. Maybe people will be interested in that. And yeah, I can do that as a talking point. But let's see, I can show you what hospice eligibility criteria are. So let's say hospice, and then let's eligibility criteria, and then let me go to images, and then I'll show you a good pamphlet that shows that. Actually, there is this one. Does this one expand? I don't know. Well, okay, yeah, this is it. Oh, good. So let me switch views. Go here. Go there. See if there's any questions. No, no new questions. But here is basically what we do for hospice. How we so a patient will come in if they have, God forbid, cancer and they don't want active treatment. We will look to see if they have any of these kind of things. So patient with cancer has to meet all the following criteria. So malignancy with widespread aggressive progressive disease, and their PPS score, that's a palliative performance scale, is 70. So you have to be like this. So your ability to move around is a little bit reduced. That's someone, I'll talk to them later. Let's see, the ability to or the activity and evidence of disease, self-care, intake, level of consciousness. So we wanted it right there. So we want full consciousness, maybe a little bit of reduced amount of intake, but something like that. And then we will refuses lifelong therapy and what have you. So it's very easy to get into the cancer. Like if someone has cancer, doesn't want treatment, it's fairly easy to qualify for hospice for that. If someone has dementia, it's much harder actually. There is something called the functional assessment scale, which is a FAST score. They have to be a 7C. That basically means an Alzheimer patient that is only wheelchair bound, essentially wheelchair or bed bound, and also has to have like these other criteria, such as fevers or ulcers, pressure ulcers on their bums, or infections in their lungs or bladder or what have you. But there are certain qualifications you have to meet in order to become a hospice patient. You just can't just randomly be a hospice patient. So some people, like to use the services who are not appropriate, and then we have to take them off hospice. They ask that question, why am I being taken off of hospice? So yeah, let's see what else. So, but let's see, I'm just looking at if there's any other viewers. Okay, looks like the view count dropped off to 0. Yay. there's a thing. Okay, well, I'll continue talking. I was thinking of also talking about makeup a little bit here and there, and I was thinking of talking about the very famous. Yesterday I talked about Oil of Olay's Regenivist and its anti-aging moisturizer, and how all of this is nonsense. And here's another one. L'Oreal has its own Revitalift, which is another nonsensical health pain. Now it may moisturize your face, that's one thing, but it removing fine lines and wrinkles, that's a joke. That's not going to happen. Visibly reduces wrinkles, no, that's not going to affirm or brighten skin. I don't know about the brighten part, and nor do I think it's going to do wrinkling or firming your skin. There's all these nonsensical things people are saying, although people are saying, some people say it's okay, it doesn't really do it. And then L'Oreal responds back saying, oh, thank you for sharing your experience with our triple power anti-aging moisturizer. We're glad you enjoyed the product, although it didn't look like she didn't look like she enjoyed the product to me. I didn't really notice much of a difference with the moisturizer. Pretty average with other terms of moisturizer. It didn't so much. It didn't. But it didn't so much for elasticity of the skin or blah blah blah. It was just overall okay. This seems cookie cutter. And we hope you try it again soon. If you didn't see the results, we're hoping to try. Yeah. So I would say a lot of these things, frankly, are useless. These not useless. Well, yes, in regards to wrinkles and or removing fine lines. No, I'm also a medical director for a medical spa that injects Botox. Now that does something, but you can only use Botox in a very specific places, and those are around the eyes or around the between the eyes, where it's only for that, and those are for those kind of crow's feet. It'll treat that. But this thing of fine lines around the face, what have you, using these creamers and these moisturizers, this is not going to do anything. This is basically meaningless. Oh, hello, thank you, SJ. Thank you very much. There we go. Thank you for that, viewer. So, but let's see. Yeah, I'm not too keen on a lot of these moisturizers. I actually started looking up some of these things, and it didn't come up with that much. Meaning, there is no medical journal science that shows anything relevant, and the journals that I did find were basically um, the articles were created by people who were employed by the company that makes the makeup or makes the foundation or moisturizer. So that's biased. There is no third party that creates studies this, and even that flawed study, it did not show any statistical difference between one thing versus the other. It was a nonsense article, frankly. Um, but you know, that's one of the way it goes. Let's see. So let's see. Is there any other coronavirus issues we can talk about before the end of the hour? Usually I end at about 1 o'clock. What's your state's coronavirus reopening plan? Frankly, I think the U.S. doesn't have. Each state doesn't have any kind of plan. They just haphazardly doing it. There's two reasons why California coronavirus won't is struggling to control coronavirus. And what are the two reasons these people are saying? Let's see. They're saying they're not here yet. Let's see. Conditions too serious. Okay, what are two conditions? Let's see. Rutherford offered two reasons why the disease is persisting. A certain percentage of people are still going out, and people are getting fed up with staying at home. So that's the reason why it's still increasing. Staying at home fatigue. I can tell you for a fact that yes, people are very tired of staying home in California in their homes, and there are lots of. When I remember earlier on, the highways were empty when I would go out to the hospital, what have you, and now it's just as if people are not going to work, but they're just out and about doing stuff. So there's and then in LA they're doing ridiculous things. They're going to the beach. That's just nonsense. At least in the Bay Area, no one's going to the beach. I think it's too cold to go to the beach anyway. In the Bay Area, going to the beach is too cold. But in LA, you can go to the beach, but those ridiculous people are just crowding themselves and just asking for more cases to be happening. So I'm not a fan of people going to the beach like that. So let's see. What else is there in news that we can talk about? Let's see. Okay, let's see. How could Corona people make move? What have you? U.S. accuses China of trying to hack vaccine research. I don't know what that's. There's all sorts of stock news happening, business news. But it looks like we're coming to the end of the hour. I just wanted to let people know that I'm here. Oh, hello, new viewer. Hello. So I try to do this from 11:30 to 1 o'clock. And hi, new viewer, if you want, you can always ask a question. I'm not going in just a second. I try to be responsive, it gets lonely doing this. Oh, he ran away, or she ran away. Who knows? So, I try to be responsive to people's questions. And if I do this from 12:30 to 1 o'clock, if you have any kind of questions, feel free to ask. I'll keep on doing this. Maybe eventually people will know that I'm there. That I'm there to answer questions, but I appreciate people's input, and thank you again for your time and attention. All right, let me change over this view. Thank you. All right, bye-bye. It's Dr. Abdullah saying bye-bye. All right, let's see.